Bismillahirrahmanirrahim. Assalamu alaikum. Even with the proper therapy of root canal and sometimes retreatment, the response is not there. So you might end up in doing endodontic surgeries. For periapical surgeries, there are indications like anatomical problem, procedural accidents, irretrievable material, persistent symptoms, horizontal apical fractures or biopsies. It's really impossible to do root canal in this case. Sometimes there's instruments breakage or irretrievable materials like this, and you can say persistent symptoms because of the failure. Sometimes you don't know what is the reason of the failure. Horizontal fracture might be a cause. What are the contraindication? Atypical factor like sinus, medical complications. So the patient is not cannot perform surgeries for some like bleeding disorders, and indiscriminate use of surgery, unidentified cause of failure. Always remember, diagnosis is very important. Usually we call this periapical surgery as apisectomy, was very done with less success, but now with latest equipments and materials and magnifications and illumination, apical microsurgeries have a very good success rate. Xalocaine with epinephrine of around 1 to 50,000, the ratio. You can use different flaps like semilunar, allo flaps, full mucoperiosteal flaps. You can use different blades for incision and reflections. Uh, so start with the flap design, then the incision, then the periapical surgery. You're supposed to access the apex, the periapical curettage, the root resection, the cavity preparation, and the filling. So first of all, let's make an outline. We're supposed to perform surgery, then access to the area of apicectomy. We are supposed to cut the tooth approximately the root portion 3 millimeter, which has the maximum ramification and lateral canals. Then you can see this shows that maximum ramifications and apical constrictions of apical or lateral canals of all into 3 millimeter of the apex. So it's important to cut this 3 millimeter of the apex. After, once you control the hemorrhage, you're supposed to do ultrasonic preparation of the cavity with a class 1 sort of cavity, and now there are more precise cavity preparation available with these instruments. Uh, you can see that if you compare with the birds and ultrasonic, the ultrasonic is far conservative. And if you compare with the size of the instruments, the micro instruments, this is the conventional mirror and this is the micro mirror. So it's very handy and very nice, you can say, mirror available which can perform surgery. You can say by which you can easily perform surgeries. So flap, then afterwards you do the apicectomy and you put some retrograde filling materials like MTA. The flap replacement and suturing is important, and post-operative care instruction like antibiotic. They always inform the patient they might be swelling there. So this is all about the apicectomy. The other thing is the root amputation. Sometimes you cannot perform uh, complete. You cannot be able to perform apicectomy. For example, a multi-rooted tooth. You just take out that culprit root. This is called the root amputation. Sometimes, for example, this is a lower first molar, and you're not able to save the distal part of the tooth. So you cut the tooth into half with the crown portion, and you remove the distal half, and you preserve the medial root, and followed by the crown. Sometimes, for example, there's a furcation involvement or some caries in the furcation area. You cut the tooth into half, for example, lower six, and you take out the caries or whatever the problem in the furcation area there. For example, a perforation, you repair it, and you make two premolars of, for example, a first molar tooth. Here you can see once you treat the pathology. Okay. So indications of this bicuspidization is untreated root perforations like vertical fractures, fracture into the furcation, or fracture, perforation, and the furcation area. So corrective surgeries, you can say when you have the procedural errors, resorptive procedures, and perforation, you just raise the flap and repair it with the help of restorative materials. Usually we use MTA for this purpose. So that was all about the different surgical approach in endodontics, like episectomies and hemisection and bicuspidalizations. Uh, Thank you very much for listening to the lecture. Okay, take care. Allah Hafiz.